one on the left with the cartoon, that's what the TV would have you believe, right? When you see commercials about antidepressants. But the reality is on the right, I'm going to go through each one of these. When I say dry as a bone, that's what they taught us in nursing school to kind of remember the major side effects. And dry as a bone used to be true, is true mainly with the tricyclics. When they say dry as a bone, it means that the person might have urinary retention. They might not be able to pee. They might get constipated. That's another problem. They may also have blurred vision, which you get as a side effect. So when they say dry as a bone, person complains terribly of having dry mouth or having blurred vision. And these side effects are things that sometimes make people stop taking their medication because they don't want to deal with the side effects. Appetite and weight changes. A lot of people hate these meds because they increase their appetite. And if you have, let's say, a woman with an eating disorder, and then they put her, and she's also depressed, and they put her on an antidepressant, and now suddenly she's hungry all the time and she starts putting weight on, she's not going to want to take the medication because she wants to stay thin. So that's an issue. Blood pressure changes, either up or too low. Some people, it makes their blood pressure too low and they can't tolerate the medication. Either it wakes them up, so we tell people to take antidepressants in the morning because it does. Some of them do have a tendency to kind of agitate you a little bit, not agitate you in an angry sense, but just get you more motivated than you have been, because decreased motivation is something that you have with depression. So the person may have insomnia, and that's my first question that I ask when a patient says to me, you know, ever since I went on that antidepressant, I can't sleep. And I'll say, what time of the day do you take it? And when they say they take it at bedtime, right away, you know, I talk with their provider and make sure that it's okay for them to take it in the morning. And most of the time, that's when they should be taking it anyway. Or especially the old tricyclics made people too sleepy. They were knocked out. Yeah, they were less depressed, but they couldn't wake up. They didn't want to get out of bed. They were zonked. And so that wasn't good either. So it could go either way. Sexual changes. In women and men, we may see inability to reach orgasm. Men may have an inability to have an erection, and if that's the case, well, you know, think about like a young, any guy, he's gonna not be too thrilled about the fact that the antidepressant has caused that to happen. So not all of them do that. Sometimes it's just a question of one being switched to another one. One has that effect, another one doesn't. They can also give an augmenting, another antidepressant to help decrease the problems with the sexual changes, and that happens. But the thing is, sometimes doctors don't ask about that, and sometimes people don't just raise their hand at the doctor's office and say, and by the way, I can't get an erection, or by the way, I can't have an orgasm anymore. They just keep quiet and they stop taking their medication, or they think that the changes in their sexuality are related to the depression, when in fact the changes are related to the medication. And I know of one couple that basically their marriage broke up over Prozac. And this was many, many, many years ago, 20, 25 years ago. And the woman lost all desire for sex. And of course, the husband figured, well, she's depressed, so we have problems in the marriage. And they went to a marriage counselor and everything. But at the time, nobody put two and two together that that particular medication was causing her to decrease her interest. So they ended up getting a divorce because they couldn't resolve the difficulties in therapy. And therapy is not going to help if you have physiologic changes related to medication. So that was a kind of a very sad story. People can also feel more anxious and restless. I'm going to talk to you in a few minutes about the potential for violence and an increase in suicidality. Now, the question is, as far as that goes, does a person become more suicidal when they're on an antidepressant because of an effect of the medication? Or do they become more suicidal because maybe 2 weeks ago when they were depressed, they didn't have the motivation or the energy to hurt themselves or to try and kill themselves? And now that they're on an antidepressant, they feel better, they have a little more strength, they have a little more energy, and that does make them at risk to kill themselves. So that's something that we watch for very carefully. Someone who, and you should watch for as well, that someone who's been very, very depressed and that suddenly they're doing better, like overnight, and they're feeling better. It could be because in their head they've decided what to do, that the answer to all of the problems is to kill themselves, and now they have the wherewithal, shall we say, to do it. So that's definitely something to think about. And hypomania. Hypomania is not full-blown mania. Mania is a whole nother discussion, but a manic person is like, they're acting like they're high on drugs, but they're not. It's not because of drugs, it's because of their neurotransmitters. And in the case of mania, they have too many neurotransmitters. Depression is too little, mania is too many. And so they need medication to bring them down. But then the problem is, once that happens, they get down, 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 and they may become very depressed as well. And sometimes people are not diagnosed as manic or hypomanic. Hypomanic means they're not full-blown manic. They're still able to maybe work and function and not get themselves into too much trouble as a result of their mania. But when someone is on an antidepressant and they've never acted like this before, like they've been put on an antidepressant, and 3 days later, they become what we call hypomanic. They have a lot of energy, they're staying up all night, they're involved in all kinds of projects, they're hypersexual, they're spending money. In a way, that's a good thing, because then that tells the provider, the physician or the nurse, whoever's caring for this person, that in fact the person is bipolar instead of just depressed. And it's like the good news and the bad, the good news and the bad news. Good news is, well, you're bipolar, or the bad news is you're bipolar. But at least if you're bipolar, then there's medication specifically for that as well. And that might not be diagnosed any other way than having this totally opposite reaction to antidepressants. So that's something else to think about.